Hi, good morning. My name is Kendra, and I'm going to be doing a newborn assessment on Marvin here. I've got all my supplies I need. I have a pen light, I have a stethoscope, measuring tape, and I have gloves. So I'm going to go ahead and I'm going to wash my hands and provide privacy. Marvin was born about 18 hours ago. He had a vaginal birth. There was no complications. So we're going to go ahead and we're going to get started on his assessment here. I'm going to unswaddle him. Alright, so first we want to look at the color, and Marvin appears to have a healthy pink color, so that's perfect. And then we want to look at his posture. He is sleeping right now, so he's relaxed. Everything looks normal there. For proportions look normal, large head, but that's normal for babies. And then movement, he responds to touch. So he responds equally with both sides for touch. And for his skin, we're seeing nothing abnormal, no bruising or anything like that. So we're gonna go ahead and we're gonna get some measurements on Marvin. So I'm gonna apply my gloves here. And first we wanna start with weight. So a normal weight for a new gram is 2,500 grams to 4,000 grams. Marvin here is 2,800 grams, so everything is good with that. He's a healthy weight. Then we want to get length. So to get length on a newborn, what you want to do is you want to stretch out their leg, and you want to measure from the bottom of the foot to the top of the head. And Marvin here is 49 centimeters, and that's perfect because the average would be 48 to 53 centimeters. And then for head circumference, we want to lift the head slightly, and we of course stay supporting the neck, and you want to measure at the widest part right above the eyebrows, and we'll wrap the measuring tape around his head, and his head circumference is 34 centimeters, and that's perfect. A normal head circumference is 32 to 36 centimeters. For chest circumference, we want to measure right at the nipple line. So we're gonna go ahead and we're gonna place the measuring tape underneath him, and he's coming in right at 31 centimeters for chest circumference, and that's great because normal is 30.5 to 33 centimeters. So I'm gonna go ahead, I'm gonna put up my measuring tape, and now we want to go ahead and we're gonna observe his respiratory status. So we're gonna start with rate. A normal respiration rate is 30 to 60 breaths per minute. So I'm gonna go ahead and I'm gonna count his respiratory rate. We do this for a full minute because babies can have an irregular rate. So I'm gonna go ahead and put my hands on his chest so I'm not only seeing the respirations, I'm also feeling them. And we're gonna go ahead and count his respiratory rate for 1 full minute now. All right, perfect. So his respiration rate was 38 breaths per minute, and like I said, 30 to 60 is normal, so that looks great. Now, it's important to look for the 6 signs of respiratory distress. Those would be retractions or the sunken in of the intercostal spaces. You also want to check for circumoral cyanosis, nasal flaring, elevated respirations or grunting, and seesaw breathing, which would be the asymmetrical chest movement. Marvin here isn't showing any signs of respiratory distress. He's looking great. To osculate his breath sounds, you always want to use a pediatric stethoscope, or in my case, I'm going to be using the bell of the stethoscope, which is just a smaller side. It helps you hear for the babies better since they're so small. So we're going to go ahead and we're going to listen to his breath sounds. He sounds great. So with C-sections babies, you always want to watch out because that could affect their breast sounds. Because during a vaginal birth, the vaginal canal squeezes the baby and it pushes out the extra secretions, but you're not getting that if the baby was born via C-section. So the babies are more prone to having secretions in their lungs, so you want to look out for that when checking breast sounds in C-section babies. But Marvin was a vaginal baby. He sounds great. Everything's looking good so far. We now want to go ahead and listen to his heart rate. So we're going to check his apical pulse here. Normal pulse would be 120 to 160 beats per minute, and we're going to listen on the 3rd or 4th intercostal space, but instead of a mid-clavicular line, you're going to listen more laterally on the babies here. So we're going to go ahead and we're going to listen for a full minute. Perfect. So he was at 158 beats per minute. So like I said, that's normal. 120 to 160 is what we're expecting. So we're now going to want to feel his pulses. We're going to feel them at the same time. We're going to start with his brachial pulses. We're going to go ahead and feel them. And perfect. Those are equal bilaterally. We got a normal rhythm right around the 158, and they're 2+ ratings. Then we're gonna feel his femoral pulses here, right in the groin area. I'm gonna go ahead and I'm gonna undo Marvin's diaper, and we're gonna feel for those. And good. They are also equal bilaterally. They're 2+ pulses, and they're right around the 158 range. So everything's looking good. So for babies, we would only want to get a blood pressure on them if there's something suggesting that there's a cardiac issue. We're not seeing anything like that for Marvin, so we're not going to check a blood pressure, but a normal range would be a systolic of 65 to 95 or a diastolic of 30 to 60. So we're not worrying about that with him, but with some babies, it would be checked. We're going to go ahead and we're going to look at Marvin's head here. And we're gonna check for his suture lines. I'm gonna go ahead and lift him up. We're gonna take a look. So we're checking to make sure the suture lines are not overlapping and they're well approximated, which they are. So everything looks good. He has 2 fontanelles here. He has an anterior fontanelle and a posterior. So the anterior, it's a diamond shaped, it's also larger. Posterior is a triangle shape and it's a smaller shape. If the fontanelles were to have been sunken, it would show dehydration. If they were to be bulging, it could show excess fluid or increased intracranial pressure, but we're not seeing that. His look nice and flat, so everything is good there. Caput succedaneum is something that you can see in newborns, and that would be a cone-shaped head, and that's just from the vaginal birth. It normally resolves pretty quickly, and you'll just see swelling across the suture lines. But that is completely normal. It's nothing to worry about. A cephalohematoma that would be bleeding in between the parietal skull and the scalp. It could be on either side or both sides, but the newborn is not born with this. It develops 24 to 48 hours after birth, and it can take weeks to months to resolve. So that takes a little bit longer to resolve. But for the next part of the assessment, we're going to go ahead and we're going to take a look at his eyes. So the eyes are a good slate gray color, and that's normal for newborns. what we want to look for is if there's any yellowing indicating jaundice, which I'm not seeing here. And then we're going to go ahead and we're going to check for his pupils. I'm going to grab my pen light here. So the pupils are round. And they are reactive to light. With newborns, we're not able to test for accommodation because the babies are not able to see far. We're now going to check the pinna, which would be the top of the ear, and we want to make sure that it's aligning with the outer edge of the eye. And for Marvin here, everything is aligning perfectly as we would expect. Pre-auricular skin tags would be little excess skin tags along the ear. I'm not seeing any on Marvin here, but if we were to be seeing those, it would be signs of a renal malformation, but that's not something we're seeing here, so that's not something we're worried about. If you were to see that, you would want to check, you would want to look more into it. So we're now going to check his nostrils. We're going to check the patency. So what we want to do is we want to make sure Marvin's mouth is closed, and we're going to occlude one nostril at a time. And while we're occluding the one nostril, we're going to feel under the other to make sure we're feeling an airflow. So on his right nostril here, we're getting a good airflow. And I'm going to go ahead and occlude the right nostril now and feel under the left nostril, and we're still feeling a good airflow. So both nostrils are looking good. We're now going to check the mouth area, and we're going to want to check for his rooting reflex first. So when I place my pinky in Marvin's mouth, he is sucking, and that's perfect. That's what we are expecting. That's what we want to see. He has a good mouth symmetry, so we're not seeing any issues that could be happening with the facial nerves. Everything's looking good there. If we were to be seeing white areas around the mouth and in the that would be Epstein pearls, but we're not seeing that with him. He has no circumoral cyanosis, which is great. We don't want to see that. If he did have circumoral cyanosis that was only happening while crying, it could indicate a congenital heart issue, but that's not an issue we're seeing. It's just important to note that if it was happening when crying, it would be linked to a congenital heart issue most of the time. We're now going to go ahead and take a look at his neck. So he has a short neck with thick skin folds. There's no webbing, which is great. We don't want to see any webbing, and there's no fat pads. His neck does move side to side easily, and there's no resistance with that, so that looks good. But like I said, the webbing or the fat pads, if we were to see that, that would be an abnormal finding. That's not something we're seeing, so his neck looks good. We're going to go ahead and we're going to move down and check out his chest and his clavicle here. So we want to check for a broken clavicle. This is very common during vaginal births. So we want to go ahead and we want to run our finger over the clavicles to see if we feel any lumps. I'm not feeling any lumps, but if we were to feel a lump, that could indicate a fracture. His chest is a normal shape. Everything's looking good there. He does have 2 nipples. That's what we expect to see, so everything's looking good. We're going to go ahead and we're going to move down to his abdomen. We're going to listen to bowel sounds first before we palpate. We never want to palpate the bowel sounds before we listen. So I'm going to go ahead and check out his bowel sounds here. Starting in the right lower quadrant. And perfect. Marvin does have vowel sounds, so that's good. If a baby was just born, the vowel sounds may not be present yet, and that would be normal if the baby was just born. But Marvin has his vowel sounds. Everything's looking good. So we're going to go ahead and we're going to feel his abdomen. We're feeling a soft abdomen. It's round and symmetrical, so that's all looking good. We want to observe his cord here. you can observe that there's 2 arteries, 1 vein, and it's a bluish whitish color. If we were to see a bulge, it would indicate a umbilical hernia, but that's not something we're seeing with Marvin here, so that's good. We wouldn't want to see that. We're gonna go ahead and we're gonna move down and we're gonna look at his extremities here. So first we're gonna check for a Moro reflex here, also known as the startle reflex. So what we do to check for that is we're gonna lift the baby barely off the ground. His head's still gonna be touching, but we're barely gonna lift him, and we're gonna drop. And baby should startle and then curl back up, and that's what we're seeing Marvin do here. So he has a good Moro reflex. So that's what we want to see. Now we want to check for hip dysplasia. So we're gonna rotate the hips out and bring them back in at the same time. I'm not feeling anything dislodging or any pops or anything, so that's good. We're now going to want to check for any extra fingers or toes, any extra digits. We want to observe the hands and feet and their creases, and make sure that we're not observing a Simon crease, which we're not seeing. We're seeing multiple creases, so that's normal. We're going to check for the Babinski reflex, which would be running the finger across the baby's foot, and as you go up, the great toe will flare up and the other toes will flare out. And we are seeing that on both feet here with Marvin. So he has a good Babinski reflex. We also want to check his hand reflex. So when we place our finger in the palm of the hand, his fingers will curl around, and that's good. And the same with the feet here, the plantar grasp. Placing the finger on the palm, not the palm, on the bottom of the foot, his toes will curl around our fingertips. And we're seeing that here too with Marvin. Perfect. We're gonna go ahead and we're gonna pick Marvin up because we're about to observe his back. So, actually before we pick up Marvin, I'm gonna go ahead and remove his diaper so we can get a good look at everything. And now we're gonna pick Marvin up. I'm gonna hold him like this to check out his back. And we're gonna wanna make sure we're supporting his neck. I'm not seeing any tufts of hair. That could indicate spina bifida, so that's good that we're not seeing that. We're not seeing any dimpling, but his back is straight, it is flat. If there was dimpling, that could indicate a pyondal cyst, but we're not seeing that. That's good. We want to look at his bottom now. His butt cheek folds are symmetrical, and both legs are equal in length. So we're not seeing any birthmarks or anything back here. So I'm gonna go ahead and I'm gonna lay him back down. And we're gonna take a look at his genitals. You want to, with Marvin being a male, we want to palpate his testes and make sure that we're feeling both testes, that they're intact in there. We also want to observe to see if there's an epispadias or a hypospadias, and I'm not seeing that. Everything's looking normal here with Marvin, so that's perfect. If this were a female, you would want to check their labias could be swollen, and that would be normal. Just because of hormones happening after birth, so that would be something to expect. We also want to observe Marvin's anus here, make sure there's not any fissures, which I'm not seeing anything, so that's good. So we're gonna go ahead and we're gonna put Marvin back on his diaper. We're all finished with his newborn assessment. Everything looks great. He seems to be a very healthy baby. We're gonna get him wrapped back up and return him to mom. Perfect. I'm gonna remove my gloves, perform hand hygiene. Mom knows that baby's safe back in the room and she has access to the call bell if needed. Thank you.